My name is Patrick Farley. I work at the University of Mississippi Medical Center. We're going to discuss some CTA cases of aneurysms. So we have a non-contrast CT on a 52-year-old with headache. Take a look at the images. You should be able to see that there's hemorrhage in the suprasellar cistern that extends out. This is subarachnoid hemorrhage. This is a CTA. We can see that there's abnormality in the region of the anterior communicating artery. This is the angiogram that gets performed. And again, we can see abnormality in the region of the anterior communicating artery. Here we can see that coils have been placed occluding the aneurysm, and that's a treated ruptured anterior communicating artery aneurysm. This is a non-contrast CT on a 60-year-old man. There's no hemorrhage, but there is a calcified mass. We evaluate with CTA, and we can see that this mass enhances. This is a large aneurysm arising from the internal carotid artery with partially calcified walls. Again, we can use the multiple planes to better identify the aneurysm. Angiography was performed for further evaluation. The aneurysm was coiled, and so that was a non-ruptured left supraclinoid aneurysm. This is a 47-year-old with headache. This is a little more subtle, but we do have hemorrhage in the suprasellar cistern and hemorrhage extending into the sylvian fissures. A CTA is performed. We see that there is abnormality in the region of the left middle cerebral artery, and that's a left MCA bifurcation aneurysm. This is a 42-year-old man with a density in the region of the right suprasellar cistern. A CTA is performed, and we can see that there's a partially thrombosed aneurysm of the right posterior communicating artery. If you take a look, you can see that there's an area of decreased density adjacent to the enhancement on the sagittal image. An angiogram is performed, and we can see that the aneurysm is somewhat multilobulated, arising from the region of the posterior communicating artery. This is another case. This is a 51-year-old man. We can see hyperdense hemorrhage in the suprasellar cistern extending into the sylvian fissures and surrounding the midbrain. There's a little more hemorrhage in the sulci of the left frontal and parietal lobes. A CTA is performed, and if you look closely, you can see there's abnormality in the region of the left middle cerebral artery bifurcation, and that is another ruptured left MCA bifurcation aneurysm. This is a 70-year-old female who had a left third nerve palsy. That should make you suspicious. We see a little bit of density, particularly in the sulci of the right parietal lobe, so we do a CTA. And what we find is an aneurysm in the region of the left posterior communicating artery, which is best identified on the sagittal images. But we can also see the neck on the coronal images. And that was a ruptured left posterior communicating artery aneurysm. This is a case where a 53-year-old female gets a non-contrast CT of the head. We can see a partially calcified mass with surrounding hemorrhage and edema. The hemorrhage is located somewhat in the parenchyma as well as hemorrhage within the ventricular system. Remember to always assess the size of the ventricles if there is intraventricular extension of hemorrhage. A CTA is performed showing a large aneurysm arising from the internal carotid artery terminus, and that is a giant aneurysm with intraparenchymal and intraventricular hemorrhage. This is another case. A 53-year-old woman presents. The non-contrast CT of the head shows hemorrhage primarily located in the posterior fossa and in the region of the left greater than right midbrain. Another view shows hemorrhage anterior to the medulla. A CTA is performed. We see some irregularity adjacent to the left medulla. It's important to look at sagittal and coronal images. On the sagittal image, we can better see that there is an aneurysm of the left posterior inferior cerebellar artery. An angiogram is performed, and we can better see the aneurysm arising at the origin of the left posterior inferior cerebellar artery. And that was a ruptured pica aneurysm. Here we see the classic hemorrhage in the suprasellar cistern, extending a little bit more to the right. Again, hemorrhage is extending more in the right frontal sulci. We do our CTA, and we see a right middle cerebral artery bifurcation aneurysm. Here is a 60-year-old female. A CTA is performed. We can see abnormality in the region of the left superior cerebellar artery, and that was a left superior cerebellar artery aneurysm. Another CT with hemorrhage in the region of the left sylvian fissure, again greater on the left than the right. We do a CTA and we see a middle cerebral artery aneurysm. This case involves a 50-year-old female who had altered mental status. On the CT, we see hyperdense hemorrhage in the right frontal lobe parenchyma and within the ventricular system. We can see that the hemorrhage tracks through the parenchyma and is close to the corpus callosum. This should make us think of a certain aneurysm site. We perform a CTA, and we can see abnormality in the region of the A2/A3 segments of the anterior cerebral artery. Please note that we don't see much in the way of venous or capillary contrast, and so this was timed a little bit more closely to arterial timing. Additionally, there's probably enough cerebral edema to slow down the capillary and venous phases. Again, we see that lack of venous contrast and just decreased other capillary and venous enhancement. So that was the A2/A3 aneurysm. This is another case, a 63-year-old woman. There's diffuse hemorrhage throughout the suprasellar cistern, extending into fissures, and looks like a parenchymal component on the right. We do a CTA, and we see a large aneurysm in the region of the posterior communicating artery. On this CTA, we can see that there's a lot of edema around the hemorrhage, and if we look at everything on the image, we can see some abnormalities in the posterior aspects of the globes. Think about what that may be called. That's called Terson syndrome, and you get hemorrhage in the eye associated with the subarachnoid hemorrhage, and it can occur due to increased intracranial pressures. In subarachnoid hemorrhage, it's quoted that 13% of patients have Terson syndrome. I haven't seen that many, but it's certainly worthwhile to take a look. As a recap, look at the initial hemorrhage pattern to better focus where you're looking on the CTA to find the potential aneurysm, and closely look at the CTA in all planes to find the aneurysm. Thank you.